Hi, Dr. Navarro here again, and of course, we'll be discussing another one of our treatments. It's called Prolozone Therapy. Now, Prolozone Therapy does not include steroids or cortisone. It's non-steroidal, and of course, we do not use any form of cortisone. This is more or less a natural injection. Now, it can be used for any part of the body, of course, joints, muscles. If you have a torn ligament, you can inject it. Those are called trigger point injections, of course. And today we're going to demonstrate basically if somebody comes in with a back problem, okay, how we basically do the injection. Now, we look at the spinal column, and you have this area here is called the C-spine, which controls the arms. This is scallo. Say hello, scallo. Hello. Right? The arms, right? That's here, C-spine. Then you have the thoracic. This is where the rib area is. From below here, of course, is called the L-spine. Now, for instance, if the patient comes in with a problem, usually it's either the disc, which is you can see in the front here. These are the discs, and on the back, I'll call the facets. Now, how we would normally do the injection, first of all, the patient would lie flat on the stomach. Alright? Then I would fill the syringe with the mineral and different cocktails in it. And of course, if the person has, for instance, L45, S1, this down here is S1, has S1 problems, I will inject here, here, here. So what I would do, of course, I use the ethyl chloride spray. This is the magic spray. It freezes the area. So we're not going into the spine. We actually injected here, here, and then at the lower part, we injecting this angle here, and then this angle here for a back injection. Okay? Now the injections usually are once a week, and usually within I would say 4 or 5, you start to see progress. And actually the pain disappears. Of course, you have the whole central nervous system passing through here, across by the butt, down the legs. So usually we normally send them for a CT scan, not really an X-ray. CT scan show up more, it's better. You can see more from a CT scan. And once we get the evaluation, we can then do the injections to suit. If it's shoulders, just give an example, as we have I'm facing that way, we will go into the back of the shoulder from this angle, straight in on either side. Okay? If it's a neck injection, this is the T, this is the beginning of the thoracic. We will go C7, 6, 5 for in between the disc. Of course, the needle will go in between the disc here like that. And we usually go 7, 6, 5, 4. We don't go past the C3 because there's an artery that passes along the neck and cut across the 3 and goes to the brain. So we can do, but most injuries are between 7 and 4. Okay, so that's basically a little bit of prolozone. Of course, you can do hip injections. We use a longer needle where we go directly. This is called the greater trochanter. So what we do, we put them on his side, we feel for the bone, and then we will inject straight down into the hip. Of course, it's a longer needle. This stays out here. And it will go into the hip, of course, and you can do both hips or one hip. It all depends. Knees, I don't know if I can show you a knee quickly, but this is a knee. Normally the person is seated like this, and we would inject into the knee on the side cavity, like that. This is the patella, sorry. The space is a little bit greater. It's supposed to have cartilage in here. So we would go like this angle into the knee when we're doing a knee injection. Alright? Alright, Skello, thank you for your help. Of course, I have to Skello back. And of course, that is more or less what prolozone injection. Of course, if you have any back injuries, torn ligaments, you can call us at 640-8985 or WhatsApp at 493-9196. Of course, we're on Instagram, we're on TikTok, and we're also on Facebook. Thank you very much.